Okay, so for the long-term care Medicaid process, whether it's for home-based community care, whether it's for a nursing facility, or if a person is in assisted living, the process always starts out the same. It's a basic 800 application. I guess I should back up one step further. Your best bet would be to reach out to your local ADRC for a packet. That packet includes an 800 application, information on estates and verification, what type of verifications that the state's going to be looking for. So once you receive the packet, you complete the application, you can send that directly to DHHS, or you can send it back to your local ADRC, which is Aging and Disability Resource Center, formerly known as Servicelink. They can assist with this process. Once the state receives the application, I believe they have like 45 days to review it and get it started. This is a great program. It helps a lot of people, and I like it for the most part. The issue is it can take 6 months or more for a person to get approved or denied, more for approved. The suggestion is, as people are going along with this process, is to get stuff to DHHS as quickly as possible, because sometimes it is the client who is delaying the process and not necessarily the state. We always blame the state for everything. It's their fault. But sometimes it's not their fault. Sometimes it is, the client's fault. They're not getting the right stuff turned in. They're dragging their feet, or they go past the time that they have, and then they need to start the process all over again. Once they are approved, they will be assigned a case management agency. The case management agency will in turn assign them a case manager. If they're unhappy with their case manager, they can speak to the agency and get another case manager. If they're unhappy with their case management agency, they can get a different case management agency also. So the process is similar to any other estate benefit that you apply for. It all starts with this 800 application, and that's where everybody should start. And just get everything in, like I said, as soon as possible to speed up the process. Otherwise, like I said, I've had some that have taken, 4 or 5 months in the past, and I've had some that have taken over a year, because people think some things they don't have to tell them about. They don't have to tell them about trust because somebody's lawyer or whatever says, no, they can't touch trust. Well, the state can do whatever the state wants to do. So just give them all your information and let them determine what they need and do not need. Nikki, are you there? Did I leave anything out? Oh, maybe she's not really there.
Sorry, nope, I just had to unmute myself. Nope, looks like you gave them everything they need. It's like you said, it starts with that 800 app, and it can take the state 6+ months. So
yeah, that's the tough part. It's really hard on people because they have to wait so long. So that being said, since the process takes so long, the ADRCs have what we call a caregiver grant, a respite grant. Sometimes what they will do is they will utilize this grant to help get them some additional supports while they're waiting for their CFI to kick in. So that's an option for them also. Does anyone have any questions that I may be able to answer? Yeah. Well, if you have any, just shoot them in the chat, or I can put my email address in there. I'll probably actually put Nikki's email address in there. And you
Nellie's
can just shoot us
hand is
questions that way. I'm sorry, what was that, Emily?
Nellie's got her hand up, or their hand up.
Oh, there is a hand up. Nellie.
Hello, everybody. Can you hear me?
Let me just turn this up again. I'm the best speakers.
So I had a question. We've had, as community health workers here in Nashua, we've had a lot of run-ins with people that would benefit from that help. Is it possible to Or do you think it's a good idea to have a training in itself to help people who are unable to just navigate and help themselves throughout the whole process?
Actually, the state does offer that for the ADRCs. We could reach out to see if they would be willing to offer one for the CHW. So that way, yes, you could assist them with this process. The only difference is the ADRCs can actually go into the state database or whatever you want to call it and look up to see what the process is, whether something's missing or something's stuck or they never received something.
Yeah.
Any notices that are sent out to the clients. The ADRCs have access to that where the others do not.
Okay. All right. Well, thank you. But yeah, that would be a good idea because we do tend to see a lot of people that could benefit from that help with someone else who's able, or I don't know, just like
Yes,
yeah.
I'll reach out to Kate and ask her if that's something that they're willing to do.
Okay, sounds great. Thank you.
You're welcome.
I think the community health workers could at least give them the 800 application to start the process.
Right, I think she's looking for some more training.
Oh, okay. Call me. No.
I saw another hand there, I thought.
I was
Maybe
like-
not.
Yeah, Karen, go ahead. I was gonna say I saw one as well. Go ahead, Karen.
Question about the grant for the caregiver respite grant. We've been trying to get that for a gentleman who lives in Bennington, and we're told that there's a huge wait list for that because there isn't enough staff. Is there another way to get that service for someone? He's very rural, and I think that's part of our problem.
And what county is Bennington?
Hillsborough.
And the reason given was because of staff or was it funding?
Staff. They didn't have staff.
Okay, interesting. I'm not sure, and they are county based, unfortunately. I can reach out to Tina at the state level and see what her thoughts are on that. Tina.
That would be great.
And Karen, that's Karen, right?
Yeah.
Karen, if you could put your email address in the chat so I can get back to you. Same with Nellie. Oh, Amber. Amber has a question.
Yeah, and it's more of just kind of a comment off of what Nellie had shared and the idea of like doing a training for the CHWs directly on kind of that process. We had done a kind of an in-house training with our local Servicelink
Yeah.
up in Grafton, and what we found is we still let them take the lead in actually submitting the applications, but it was super helpful for us to understand more about the process, how to get started, and the documents that the clients would need to collect throughout the process. It really, I think, kind of helped us move things along faster, put a little bit less pressure on the clients. So while we're not the ones actually, providing the service of submitting the application and doing all of those things, it really did help facilitate kind of a smoother process for the clients. So I think, Nellie, it's a great idea to have a training for CHWs in the area. And yeah, so even if you're not the ones actually doing the application, it made a big difference in how we could participate in the process and take some of the pressure off of the clients.
Okay, and Nellie, I'm sorry, I have another question for Nellie. Nellie, have you reached out to your local ADRC or Servicelink for assistance with this?
I would say no. I think like the cases we've been seeing have been like within the past 2 months, and we're all just trying to like gather as much as information as we can, and we forward it to someone. But I think it would be beneficial for the team here to just like learn so that we can like have them in a different spot by the time we're sending them somewhere else. Like I don't know. Yeah. So something like that.
Okay,
Yeah.
thank you. Karen, are you back again? Karen, did you have another question? Or maybe she just forgot to put her hand down? Maybe she stepped away. I don't see any other questions. Does anybody else see any other questions? Change pages, nope. Okay, well, I will, Nikki, did you put your email address in the chat?
I did not, but I can definitely do that.
Yeah, if you could, and if you have any questions, please reach out to Nikki or myself. I'll put mine in there also. And yeah, we're happy to help.
Excellent, thank you. Did you also, and sorry to kind of put you on the spot, we talked about this in email though. Did you want to talk about Wellness Link at all? Or was the person who does Wellness Link on here or not?
No, she's not. I
She's
didn't
not,
want
okay.
to ask her at the last minute. That was
No,
my
that's fine.
bad. Wellness Link is a statewide program that started out assisting people 60 and over with COVID vaccines, scheduling them, giving them information on it. Since then, it has also grown into a social isolation program where we have Krista goes out to various organizations within the community for the entire state. It's her and Faith, who is part-time, to basically spread the word on Wellness Link and what it is and how they can help. She offers information about artfully aging, for example. She does trainings on those. They're so cute. They're so cute. They have these little pictures and everybody gets to paint a picture. She does that at different senior centers and other organizations that are willing to have her come in. She also has a, what I call a one-stop shopping community calendar. Other organizations can partner with Wellness Link to put their events on our calendar. This makes it so people from anywhere in the state can go to our calendar, search by location if they want to, and find out what's going on that they may want to attend. I would like to, at your next meeting, if possible, have Krista give you a more in-depth overview of Wellness Link, if that's something that you think you'd be interested in.
Yeah, we could definitely do that. I'm not sure of our next one, but we'll get you on the, I have a calendar of people that, yeah, we can get you
I will
to
let
come
her
back.
know. I'll
Yeah.
let her know to expect an email from you.
Okay, sounds good. Yeah, and I did put the link to overall Wellness Link and also to the community calendar. I did go to a training on the community calendar a while ago, and it's got all kinds of
good.
great stuff on it. So I put the link in here. Yeah,
I know, I like checking it out myself.
yeah, good stuff. Okay, well, thank you for that brief
You're
overview of
welcome.
it. Does anybody have any questions about Wellness Link? Cindy,
Oh.
go ahead. Oh, I thought you did.
Sorry,
Maybe-
I meant to. So no, I don't have a question, but I do wanted to something that you said, Emily, about the calendar. You say you put the link in it to check it out, all the trainings and stuff like that in there.
No, the calendar that I put in is the wellness linked calendar that Joyce was talking about.
Oh, okay,
Yeah.
gotcha. Yeah.
Yeah.
I get confused. So sorry.
No, that's okay.
Okay.
All right. Any other questions or comments about Servicelink or Wellness Link?
Oh, remember, Servicelink is now being called the Aging and Disability Resource Centers of whatever county it may be. Eventually,
Okay.
it'll probably be shortened to ADRC Belknap County, ADRC Hillsborough County. But they're
Gotcha.
gradually eliminating the Servicelink name.
Okay, that's great to know. Thank you. All right, well, I'm going to stop the recording then.